Mr. Davies, a 45-year-old man with a diagnosis of paranoid schizophrenia, has a history of multiple relapses requiring inpatient admissions, often precipitated by non-adherence to medication. He generally lacks insight into his illness when unwell, but engages reasonably well with community services when stable. Following his most recent admission, the MDT believes that a period of compulsory supervision in the community would significantly reduce his risk of relapse and ensure continuity of care. Which legislative principle allows for compulsory treatment in the community for high-risk patients like Mr. Davies, while allowing them to reside outside a hospital setting? So if we look at our options, Section 2 is an admission for assessment, Section 3 is an admission for treatment, a community treatment order, a guardianship under the Mental Health Act, or DOLS, deprivation of liberty safeguards. So we can take out Section 2, take out Section 3, but hold the thought. It's either a community treatment order, guardianship, or deprivation of liberty safeguard. Now, the DOLS framework is part of the Mental Capacity Act. So if we consider in the question that the piece of legislation is allowing for treatment of a mental disorder, it's not a DOLS. Guardianship refers to a piece of the Act that essentially places someone under the community care of the local authority for residential purposes and for support with attendance at appointments. So it's not that. It's a community treatment order. Okay, so I shan't read this out to you folks, but effectively a community treatment order, the reason I say hold the thought on Section 3, it only applies to patients who are subject to Section 3. So if a patient's subject to Section 3, at the point of discharge, the community treatment order can be put in place. So what this requires is the responsible clinician to write a CTO1 that effectively grants the community RC the powers of recall. Okay, so there are conditions written within the CTO1 paperwork. Worth looking at the Mental Health Act paperwork, so you can go onto the .gov website and you see the CTO1. You won't be tested on this necessarily in your exams, but you see the CTO1 allows for the responsible clinician to write conditions. So they're usually adherence to treatment, making oneself available for appointment and related to residence. And if there's a breach of said conditions, then the responsible clinician has the power to recall the patient back into the community. And then what happens is that initial Section 3 is reactivated, so to speak. So a section when the patient's out on a CTO, it's called a Section 17A. When they're recalled, it's called a Section 17E. And if the CTO is revoked, then the previous Section 3 is reactivated, so to speak.